Welcome to Trafford Pulmonary Rehabilitation Education videos. What is COPD? COPD stands for Chronic Obstructive Pulmonary Disease. The word chronic means a long-term condition, and the word pulmonary is the medical term for lungs. So this literally means a long-term condition of the lungs where there is an obstruction to air flowing in and out of your chest. COPD is an umbrella term for a group of lung conditions. Patients with COPD may have quite different symptoms depending on whether they have chronic infections, which is called chronic bronchitis, or damage to the air sacs, the alveoli, which is called emphysema. Patients often have symptoms of both conditions. In order to look at how the lungs are affected by COPD, we need to go back to this diagram of the structure of the lungs. The parts of the lungs that are affected by COPD are the air sacs, the alveoli, and the bronchioles, the smallest branches of the windpipe. If we look at the structure of the bronchioles, inside the bronchioles there is normally small amounts of mucus that is produced. This sticky mucus, called phlegm, is important in catching dust, dirt and bacteria when you breathe in. What normally happens is when you cough, small amounts of this mucus or phlegm goes up to the back of your throat and you automatically swallow this regularly throughout the day. In COPD, you can get a big build-up of this phlegm or mucus. This inflames the airways and it causes an obstruction to air flowing in and out of your lungs. This can make it more difficult to breathe. In addition, that excess mucus can hang around in the lungs and harbour bacteria, dust and dirt, which can lead to infections. The mucus can also cause that symptom of a cough, where you can feel that you have the phlegm on your chest and you are trying to move that out of your chest by coughing regularly. The air sacs or alveoli can also be affected by COPD. In emphysema, some of these air sacs can break down. This reduces the area that is within the lungs for air to flow into the lungs, and it can make it more difficult for that vital oxygen to get from inside your lungs into your bloodstream. What causes COPD? Smoking is the main cause of COPD. Most people that have COPD will be current or ex-smokers. Passive smoking can also lead to COPD. For example, if you were exposed regularly to a smoky environment during work. Exposure to dusty environments or certain other chemicals can also cause COPD. And there are inherited forms of COPD, particularly emphysema.